Hello, lovely. Are you alright? Good. Yeah, I'm not bad, thanks. So, I have you in for a yearly health check. Nice to meet you. I've not seen you before, but I believe you've been a patient here for some time. Great. So, I'm Dr. Nicola. And you are? Great. Just checking I've got the right patient. Wonderful. And your date of birth? Thank you. Right. What I'm going to do is get straight into the exam, and if I've got any questions or anything like that, I'll discuss that towards the end of the appointment. Alright, so please think of any questions you'd like to ask me, and we'll talk through that a little bit later. Alright, my lovely. Good. So, how are you feeling in yourself? Okay, I'm doing alright. Good. You're not concerned about anything in particular? Okay. Alright, well, I'll do my checks and then we can have a little bit of a chat. Alright. So, I'm going to start off with just checking your temperature, if that's okay. Okay. Right, I'm just going to pop this inside your ear. Okay. Great, and just check the other side. That's good. Okay, so temp. Wonderful, that's good. I don't know whether you've seen one of these or not, but I'm going to pop this on your index finger and it's going to measure your pulse and oxygen levels. Okay? Right, if I can have one of your fingers. Thank you. Now just relax for me. That's perfect. Great. Okay, you can relax. Great, that's good. Now, I'm going to get my stethoscope. And I would just like to listen to your heart and your lungs. Alright. Okay, I would like you to just breathe normally. Okay. Okay, we need to get down onto your chest. Okay. When you're ready. Thank you. Okay, if you take a nice deep breath in, hold it, out, hold, out, in, hold, out, in, hold, out. Okay, can you just cough? Cough? Great. Just going to pop it at the back. Take a nice deep breath in. Hold it. Release. Normal breathing. Take a nice deep breath in. Hold. Release. Okay, thank you. All sounds nice and clear. Okay, so your heart and lungs sound perfectly fine. Alright, not concerned about anything there. Okay. Now, I'm going to take your blood pressure a little bit later. Alright, I like to do it a little bit later through the appointment. Okay, my love. Right. Did you bring a urine sample with you? Perfect. You can just pop it on the side for me. Thank you very much. Okay. Now I'm going to get you to blow inside of this peak flow monitor. Alright, just want to see how much oxygen you have. Okay. Okay. Round mouth on it. That's it. Close it nicely. Okay, you want to take a nice big. Okay. Let me take that. Okay. And when you're ready. Okay. Not bad. And last time. Okay. Okay. Not too bad. You're not asthmatic, are you? Okay, so peak flow. It's not bad. It's probably a bit on the lower side, but that's why I asked if you were asthmatic. But you know, have you been having any problems with breathing or any heaviness in your chest, pain or breathlessness? Okay, so just keep an eye on that. It could be if you're feeling a little bit anxious and overwhelmed that you're here. Alright, but I will keep an eye on that. I might get you to come back just to check that. Yeah, I mean, you're averaging around 400, which is quite low for somebody that hasn't got asthma. But for an asthmatic, that's probably about, it's a bit higher on. Yeah, so I just want to keep an eye on it. Okay, that's fine. Nothing to worry about though. Like I said, sometimes if you had a cold, flu, or you know, you may be anxious and things like that. All right. Okay. Good. All right. I'm gonna have to put some gloves on now. Okay. So, in for the full works today, so we'll have to take some blood later. Okay. Right. Okay, I'm going to have a look in your mouth. Okay, so I've just got my depressor. Right, if you open nice and wide for me, thank you. Right, how's your oral health been? Your teeth okay? You up to date with your dentist appointments? Okay, haven't you been having any mouth issues or anything? Okay. Okay, pop your tongue right out for me. Coloured up. Okay, and back. Right, say R. Good. Okay, I'm going to pop this in. Say R. Okay. Okay. And again. Okay. Right, I'm just going to get your, that's it. And the upper. Okay, looks good. Thank you, can relax. Just need to sanitize. Okay, I'm going to have a look in your ears. Have you been having any problems with ears, any hearing issues, any pain or anything like that? Okay, good. Right, just relax for me. And in we go. Looks good. Yeah, looks really healthy. There's a little bit of wax, but it's quite a normal amount. Let's go a little bit deeper. Yeah, no signs of infection, no swelling, no inflammation, no redness. Looks all good. Okay. Right. Okay. Other side. In we go. Yes, good. Yeah. Looks nice and clean. Let's go a bit deeper now. No swelling, no redness, no inflammation, no signs of infection, so it's good. Perfect. Great. I'm happy with that. I'm just going to feel around your ears if that's okay. Okay. All right. all feels good, and I'm guessing you had no pain. Good. Now I'm just going to see how your hearing is. I just want you to tell me if you can hear what I'm doing, alright? Ready? Okay. Now I want you to repeat what I'm saying. Doctor. Nicola. Beautiful. Pretty. Stable. Buttercup. Roses. Flowers. Pineapple. Vegetables. Sausages. Chocolate. Delicious. Perfect. Well done. Very good. No problems with your hearing. Okay, but if you do have any in the future, please come back or go and see maybe an ear specialist or something like that, just to keep on top of your hearing. But as far as I can see at the moment, there's nothing flagging up to me that you've got any issues. Alright, okay, that's good. Right, now I'm going to have a feel around your scalp, and I'm going to come down, check your sinuses and your glands. Is that alright? Okay, my lovely. Alright, stay there for me. Okay. Feels all good, and I'm guessing you didn't feel any pain. Alright. Okay. Okay, open your mouth, close, open, close. Now can you do a chewing action? Okay, and now yawn. Okay, I think that's good. Okay, that feels good. Right, now I'm just going to feel it down your arms. Okay. Bit clunky. Give that a while, or okay. Any pain with it or anything? Okay. And the same that side. Okay. Can I feel it up? Okay. Let me know if you feel any pain. Okay, take a deep breath in, hold, okay, release. Okay, now cough for me, and again. Okay, any pain or anything? Perfect. Okay, let's check your reflexes. Tummy feels fine, I can't feel any swelling, any hernias or anything like that, okay? Right, if you just droop your arm for me, let it flop. Good. This side. Good. Okay, droop your legs. Okay. Perfect. All good. Right, I'm going to have a little look in your eyes, okay? Now bear in mind I'm not an optician, but I can see if there's anything medically going on, alright? But if I am concerned, obviously I would suggest you go to an optician. Okay. Now with your eyes, just look up. Look left. Look right. And back at me. They look nice and clear. Look there for me. Keep looking there with your eyes, that's it. just relax for me, okay? Your eyes are clear and nice and healthy, okay? Okay, that's fine. Now, what do you like with blood tests? Are you okay? Okay. I want to take your blood pressure. Okay, pop your arm in there. That's it, like so. Thank you. Now relax for me. Okay, that's pretty good. Okay. That's in the normal range. Okay. No issues there. Right, so how are you with blood? Okay, so if you can just do that for me, okay, just squeezing both sides. Whilst you're doing that, I'm just going to have a feel down your legs, okay? Any pain anywhere, my love? Okay. Sway. Okay, good. That's fine. Okay, that's fine. Right. So let me have a feel, my love. Okay. just relax for me. Okay, my love. So I'm going to take your blood in a moment, okay? Just gradually, just sit a little bit with your hands like that, okay? Just want to ask a few questions first, just because I'm doing the blood. Obviously, I need to know if I need to add anything else on. Okay, so are you experiencing any symptoms of anything that you want me to take a look at or anything like that? Okay. Okay, so when you say tired, how tired? Okay, so you're feeling quite lethargic. So you're quite fatigued. Okay. Headaches. Okay. How often are you getting headaches? Okay. Yeah. Okay. And okay, so how often are you actually going to the toilet then? Okay, so about once a week. Okay, that's not very much. Okay, you're getting enough fibre, or do you have IBS? Okay. How's your water works? Going regular, or are we going quite a lot? Okay, it's quite excessive. Any pain, burning, sting or anything like that? Okay, that's good. Okay, that's great. Okay. So you've just been getting a bit achy everywhere. So we're talking quite a lot of pain, or? Yeah. Okay. How long have you experienced that? Okay. Yeah. All right, lovely. Okay. So you say you can't lose weight. Okay. Would you say you've gained weight as well, or? Yeah. Okay. So weight gain, struggling to lose weight. Okay. Are you actively trying to lose weight? Okay. What kind of things are you doing? Yeah. Okay. So quite some time then. All right. Well, do you mind just popping on the scales for me, just over there? Thank you very much. Now let's just have a look what weight you were before. Okay, so okay. Okay, my lovely. Can you sit back down? Okay, yes, there is a considerable amount of gain, but I'm more kind of concerned about the losing the weight than necessarily popping the weight on. Yeah, obviously we've had Christmas, different things like that. You know, warm, colder months usually people exercise less, move less, and different things like that. So, but you know, I do think that we might need to check, see if your thyroid's working okay. How are you with your libido? Is that okay? Is it low, or? Okay, so is that a sudden change for you? Okay, so low libido. Yeah, that must be quite difficult for you. Yeah. Yeah, especially if you've gone from, say, being quite active and then, yeah. Okay, you're in a relationship. Okay, and how are things? Well, that's good. Are they understanding, or? Yeah, well, that's great. I'm glad to hear that. So understanding. Keep talking as well and communicating, all right? Make sure you're telling them how you feel. Yeah, and how, what's bothering you and different things like that. Just be open with how you feel mentally and physically and things like that. Okay, I think it's important. Just try to spend some time together, and try to start from basics and work your way up and things like that. There's definitely some things out there that are worth looking at to try and help improve libido, mood and things like that. Okay. Okay, so how would you say your mood is normally then? Would you say you've got quite a low mood? Is it, you know, up and down? Okay, low mood, but up and down as well. Okay. Let me just remind me, do you have a history of mental health? Oh, yeah, okay. Okay, so you are on those. Are you still taking those medications? You are, okay. And how are you feel getting on with them? It's been quite some time, hasn't it? Okay, do you feel like you could do with a review on your medication, or? Okay. I mean, I can review them, but I think with some of the medication that you are on, it's probably better to see maybe more a psychiatrist to assess those individually. Yeah, you can only mess with certain levels of medication, but I'm not necessarily thinking that it's your depression and that's causing it. I'm wondering if you have an underactive thyroid. Yes, because you've got the fatigue, the tiredness, the constipation, struggling with the weight. You know, you've got some chronic pain, and you've got low libido and low mood, a bit of depression. Yeah, exactly. Expected underactive thyroid. Okay. So it could well be that. It could be other things. All right. I mean, you could be anemic. So we'll have to check your iron levels. Okay, and we'll have to check obviously the thyroid as well, and a couple of other things that we'll be checking with the bloods. Now, you haven't got a puffy face, you're not massively overweight, you haven't got any changes in your voice or anything like that. Yeah, because that can happen if it's left untreated. You can have hearing problems and things, and your hearing sounds fine. So if it is that, you know, it could be early or very minimal, but we can get it treated. Okay. Right. Okay, so I want to check vitamin D and calcium, sodium. I want to check your thyroid, glucose. I want to check your iron levels, B12, B9, the full blood count. I want to do cholesterol, do a diabetes check on you as well, and a couple of other things. That's it, yeah, that's good. Okay, well, I'll get the form out and I'll have a look through, and I'll just tick anything relevant. Okay, good. So I'll do your bloods in a moment and check your urine, see if your urine is showing up any infection or anything like that. Okay, that's fine. So I'll go back to that page. Now, I know we've briefly touched on mood and things, but how are you in yourself? Are you feeling fine? Not too bad? Are you struggling at the moment, or? Okay. So how's, yeah, okay. Yeah. Yeah. Okay. Yeah, I could definitely probably look at your medication. I mean, you've not had an increase for a while. Let me just see. Okay, I could up the antidepressant slightly for you, okay, and see how we get on. But other than that, I would need to get you to the mental health team, and I can do that as well. Okay, right, so I'm going to up that slightly. Okay, it's not going to be a lot. 25 on that one. And then I'm going to get you into the mental health team. Okay. And you can go and see somebody. and then they can do a nice assessment on you, okay? Just to make sure. But obviously in the meantime, testing all these things. All right, we just have to be careful because you do have a history of obviously mental health issues. You are on mental health medication. So, yeah, exactly. Right, my love, let me just get... Okay. Right, so blood form and medication. Okay. That is for you, my lovely. Thank you very much. Now I need to tick off these bloods. Okay, that one. Perfect. Right, so that is ready for me to do. Okay, let's do a couple of more pumps for me with your hand. Do you have any questions at all? Okay. Okay, let me have a feel. This one. Okay, on to the other one. Thank you. Right, this is just going to cleanse the area. Okay. Okay. Overall, I'm impressed with everything. I'm not particularly concerned about anything apart from obviously thyroid or, you know, your mental health and things. I mean, if it is something with your mental health, it could be that's affecting your libido. Yeah, and obviously again that could be affecting like weight and food intake and different things like that. Okay. Okay, that's that done. Right, my love. Let me just check. Oh yes, good. Okay, it'll be 3 bottles today. All right, 1, 2, 3. Yes, that's fine. Okay. Okay. Relax for me. Okay. Nice breath. Sharp scratch. Thank you. Really well. Good. And last one. Okay. How was that? Not too bad. Good. Now, if you can just put a lot of pressure on that for me, thank you. Okay, you keep doing that for me. Excellent. Okay, and pop the blood form in there too. That's good. That will go today. Right, let me just have a look at your... Oh, that's lovely. Okay, I'm just going to pop you these little patches on, okay. Wonderful. There we go, my love. Right, I'm going to check your urine to finish. Leave that to do. Right, so any questions for me? Okay. Now I'm going to send these off. If there is any problems, you will get a call. Alright, but if you don't hear anything, you know, assume everything's fine, but if you would like to just check anyway, just give us a ring. Alright, just in case. Yeah, I've tested a few on your hormones. Alright, I'm wondering whether you could do with seeing an endocrinologist or something like that, okay? There might be other things going on with other hormones and that, okay? Especially the things that you've described to me. Alright, my love. Right, let me have a look at you. Absolutely perfect. Excellent. No problems there at all. There we go, pop that in the bin. Brilliant. Okay, so we'll pass all this on as well and pass you over to the mental health team. You've got your prescription, please start taking that ASAP. Okay, and then if there is any problems obviously with the bloods, we can get you treated accordingly. Alright, my lovely. Okay, so are you happy with everything? Good. You are very welcome, my lovely. I am happy with everything and the plan going forward. Alright, and I will be in touch. Alright. You're very welcome. You take care now. Bye-bye.